Hi there, and welcome to Magnolia Wellness. Today we are going to be talking about coping with anxiety. I will be happy to answer any questions you may have. Just leave them in the comment section below. Part of this presentation will include some basic well-known knowledge, while the other part of it will hopefully contain new information. I will note beforehand we are not a medical facility, and any information in this webinar should be discussed with a licensed healthcare provider. So we are going to go ahead and jump right in since we got a lot to cover. To kick things off, we are going to be talking about types of anxiety disorders and statistics for anxiety. So for those of you who don't know who the ADAA is, they are the Anxiety and Depression Association of America. Many of you have probably been told that anxiety is in your head, or that it's not real, or that you may be exaggerating it. But this association states that anxiety disorders are real, serious medical conditions, just as real and serious as physical disorders such as heart disease or diabetes. They are, in fact, the most common and pervasive mental disorders in the United States. Furthermore, anxiety actually stems into multiple branches, such as general anxiety disorder, panic disorder, panic attacks, agoraphobia, social anxiety disorder, selective mutism, separation anxiety, specific phobias, OCD, and PTSD. Usually, depression will accompany anxiety because a patient is usually unable to perform their normal routine and/or task, and as a result, they find themselves feeling depressed. Statistics show that nearly 40 million people in the United States experience anxiety in any given year. Approximately 8% of children and teenagers experience an anxiety disorder, with most people developing symptoms before the age of 21. Additionally, only about 1/3 of those suffering from an anxiety disorder receive treatment. This is likely due to cost. In addition, according to the World Health Organization, 1 in 13 globally suffer from anxiety. They also report it is the most common disorder worldwide. So what are some of the symptoms you may feel with anxiety? Let's talk about that. Symptoms may include, according to Mayo, feeling nervous, restless, or tense, having a sense of impending danger, panic, or doom, having an increased heart rate, hyperventilation, sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, insomnia, experiencing GI problems, having difficult controlling worry, and having the urge to avoid things that trigger anxiety. What you may be asking is, why are you feeling the symptoms that you are feeling, and where is the anxiety coming from? Everyone is familiar with the nervous system, and for those of you who have taken anatomy and physiology may remember the branches of the nervous system. So here we have the central nervous system, and this is the body's master control unit. Under here, you'll find things like the spinal cord, the brainstem, and the brain. Over here, we have the peripheral nervous system. You have probably heard the term peripheral from peripheral vision, which is your side vision, and it usually means out of direct focus and on the outside. It is the same sequence as the peripheral nervous system, which makes it easy to remember. So the peripheral nervous system divides into the autonomic nervous system and the somatic nervous system. The somatic nervous system controls voluntary movement, and the autonomic nervous system regulates involuntary movements. From the autonomic nervous system, we have the sympathetic nervous system and the parasympathetic nervous system. The parasympathetic nervous system calms the body and helps the body to conserve energy. The sympathetic nervous system prepares the body for action and stress. This is called fight or flight, which most of you are familiar with. If we look at the chart under the sympathetic nervous system, we can see the general body responses, which is where the symptoms that you're feeling are coming from. Your body is literally going into survival mode and trying to protect you. So the next question is, what type of signaling is going on in your brain? Let's take a look at that. So what happens in your brain? Well, there's quite a process that goes on. According to Harvard, information is sent to the amygdala, an area of the brain that contributes to emotional processing. The amygdala interprets the images and sounds. When it perceives danger, it instantly sends a distress signal to the hypothalamus. The hypothalamus is a bit like a command center. This area of the brain communicates with the rest of the body through the autonomic nervous system. After the amygdala sends a distress signal, the hypothalamus activates the sympathetic nervous system by sending signals through the autonomic nerves to the adrenal glands. These glands respond by pumping the hormone epinephrine, also known as adrenaline, into the bloodstream. As epinephrine circulates through the body, it brings on a number of physical changes. Meanwhile, epinephrine triggers the release of blood sugar, glucose, and fats from temporary storage sites in the body. These nutrients flood into the bloodstream, supplying energy to all parts of the body. As the initial surge of epinephrine subsides, the hypothalamus activates the second component of the stress response system, known as the HPA axis. This network consists of the hypothalamus, the pituitary gland, and the adrenal glands. The HPA axis relies on a series of hormonal signals to keep the sympathetic nervous system, aka the gas pedal, pressed down. If the brain continues to perceive something as dangerous, the hypothalamus releases corticotropin-releasing hormones, which travels to the pituitary gland, triggering the release of adrenocorticotropic hormones. This hormone travels to the adrenal glands, prompting them to release cortisol. The body thus stays revved up and on high alert. When the threat passes, cortisol levels fall. The parasympathetic nervous system, aka the brake, then dampens the stress response. So what causes anxiety? We're going to be talking about chemical disproportion, genetics, vitamin deficiencies, medication supplements and medical conditions, hormone imbalances, poor gut health, and current stress or post-trauma. So let's dive into chemical imbalance. Healthline shares with us the most common evidence used to support the chemical imbalance theory is the effectiveness of antidepressant medications. These medications work by increasing the amounts of serotonin and other neurotransmitters in the brain. But just because a person's mood can be elevated with drugs that increase brain chemicals doesn't mean that their symptoms were caused by a deficiency in that chemical in the first place. One study estimates that current antidepressants on the market only work in about 60% of those with depression, while the Cleveland Clinic states, studies have shown that severe or long-lasting stress can change the balance of chemicals in the brain that control mood. And while 60% doesn't seem like a very high number, you technically have a little more than a 50-50 shot by taking those medications that could actually benefit you when it comes to anxiety. But that doesn't mean that there aren't other things going on in your body causing anxiety. Let's take a look at genetics, for instance. Most people don't know it, but genetics play a strong role in whether you may or may not develop anxiety. Everyday health shares. Individuals inherit a predisposition to being an anxious person, and about 30 to 40% of the variability is related to genetic factors, explains psychologist Amy Przorsky, an assistant professor in the Department of Psychological Sciences at Case Western Reserve University in Cleveland. A genetic predisposition to anxiety could start young. Studies have shown that when anxiety develops before the age of 20, close relatives are more likely to have anxiety as well. A study published in the June 2013 issue of the Journal of Anxiety Disorders underscored that certain anxiety traits correlated with panic disorder are evident by the age of 8. Researchers have tried to better understand the genetics behind anxiety disorders by looking at whether relatives have the same anxiety disorder. They have found that people are at significantly greater risk for panic disorder if they have a twin who has it, and at somewhat greater risk for panic disorder if a first-degree relative, such as a parent or sibling, has it. The next thing we're going to talk about is poor gut health. We've all heard the saying, you are what you eat. You hear naturopathic physicians preach on gut health, and there's a very important reason for that. It's considered the second brain. Your gut contains neurotransmitters such as acetylcholine, dopamine, GABA, norepinephrine, oxytocin, just like your brain does. In fact, 90% of the body's serotonin is found in your bowels, and the other 10% is found in the central nervous system. Serotonin is responsible for things such as your mood, appetite, and sleep. Body ecology shares, if you have ever taken an antidepressant, you may know that the body eventually builds up a resistance to SSRI medication. In psychiatric care, it may turn out that instead of treating depression with an SSRI medication, physicians could just as easily prescribe a specific probiotic supplement. This would benefit not only gut health but also brain health. As Canadian neuroscientist Jane Foster reminds us in Hurley's article, the crosstalk between the gut biome and the brain is continual. That's the important take-home message. These are not two separate systems. They are two parts of a single system. Just recently, scientists have discovered that certain bacteria have the special ability to generate that feel-good mood. Some beneficial bacteria that have taken up resistance in the gut will actually increase GABA receptors in the brain. When there are more GABA receptors in the brain, more GABA is being put to good use. This is a good thing, especially since a decrease in GABA receptors has been associated with mood disorders like chronic depression. So let's talk about hormone imbalances. You may have heard about hormone issues such as postpartum anxiety, menopause, thyroid disorders, carcinoid syndrome, Addison's-Cushing's disease, or PMDD causing anxiety. But what about the actual hormones that are causing those imbalances, and what blood tests can reveal that? Take a look at the following levels you can ask your doctor to check. We have your thyroid panel, your TSH, reverse T3, free T3, free T4, thyroglobulin antibody, thyroid peroxidase, and T3. We have estradiol, estriol, progesterone, testosterone, free testosterone, SHBG, and estrone, which are your hormone panel. And then finally, we have the cortisol panel, which is your ACTH blood draw, and you will need a saliva cortisol test to check those levels. So let's talk about vitamin deficiencies. Rarely will any physician run blood tests to check for a vitamin deficiency. Many of you may have heard of the show Laguna Beach or The Hills. Lo Bosworth is a prime example of suffering anxiety because of a vitamin deficiency. In Well and Good's interview, Lo states, "It all developed into a feeling of anxiety that lasted for almost 2 months without any relief. I mean, can you imagine having a 60-day-long panic attack? I can now, I lived it." She started therapy and medication, but showed no progress even after 8 months. And then a blood test revealed the problem. She was deficient in vitamin B12 and vitamin D. Bosworth was shocked. She was young and ate healthy. How could this happen? It turned out her genes had a mutation. Armed with this new knowledge, she upped her supplement intake and started taking probiotics. In addition to more vitamin D and B12, she started taking magnesium turmeric, vitamin D3, serenol for PMS, and omega-3s. Ready for the happy part? 6 months later, she was 100% back to her happy self. It's important to have your physician perform a vitamin panel, a CMP, A1C, omega-3 levels, and you can even ask for a standard CBC panel and ANA. ANA is to check for any autoimmune disorders. It may be worth asking to test your microbiome as well. Your microbiome is genetic material of all the microbes, which include bacteria, fungi, protozoa, and virus. It is present on human tissues and biofluids. The genes in a person's microbiome is 200 times the number of genes in the human genome. There is some speculation if you can actually test your microbiome or not, and so following up with a physician would be best. Let's dive into medications, supplements, and medical conditions that can cause anxiety. This is not a complete list, but this will help give you an idea of some things that can trigger anxiety for some people. So medications that may cause an increase in anxiety are Excedrin, corticosteroids, ADHD drugs, asthma medication, thyroid medication, seizure drugs, medicine for Parkinson's disease, cough medication, and decongestants. Miscellaneous items that may cause an increase in anxiety are caffeine, too much B6, food additives and coloring dyes, alcohol, cigarettes, and obviously drugs, weight loss products, coffee, and mocha. Medical conditions that can cause or mimic anxiety are dysautonomia, which branches into a more familiar term called POTS or IST, MEN1, MEN2 genes, which cause carcinoid syndrome, thyroid disorders such as hypothyroidism or Graves' disease, diabetes, hypoglycemia, lupus, hypertension, pregnancy, epilepsy, anemia, folic acid anemia, Meniere's disease, asthma, and many, many more. The last one we're going to talk about is current stress or post-trauma. Post-trauma may last months or years with triggers that can bring back memories of the trauma, accompanied by intense emotional and physical reactions. Symptoms may include nightmares or unwanted memories of the trauma, avoidance of situations that bring back memories of the trauma, heightened reactions, anxiety, or depressed mood. Treatment includes a variety of different types of trauma-focused psychotherapy, as well as medications to manage symptoms. Current stresses can cause anxiety, such as bills, raising children, a difficult marriage, a chaotic job, etc. What's worse is many don't realize the physical and mental stress they are carrying with them until they see a therapist of some sort. Next, we're going to be talking about naturopathic approaches and modern medicine approaches. So the first one we're going to talk about is the modern medicine approach to anxiety. Most providers will start cognitive behavioral therapy with a board-certified therapist, whether it's in person or online. Now, if you do go online, we recommend faithfulcounseling.com. They will also run a hormone panel, vitamin panel, a CMP, or any scans that they find necessary. If there are any hormone imbalances or vitamin deficiencies, they will prescribe the proper medication and or procedure to treat this condition. For example, if you're diagnosed with low cortisol, your physician may start you on steroids. They will also review any medications that may be causing anxiety. They will likely refer you to a psychiatrist, a physician who prescribes anxiety medications. Many confuse a psychiatrist and a psychologist. A psychologist has a doctorate in counseling but cannot prescribe medication. Anxiety medications may include SSRIs, Zoloft, Lexapro, Celexa, etc., or benzodiazepines, Valium, Xanax, etc. They also may use GeneSight psychotropic testing, which looks into your family's genes to see if you would respond better to a certain type of medication. They will also recommend physical exercise and to get plenty of sleep. They also may recommend sleep medication. Now let's look at the naturopathic medicine approach. Most naturopathic physicians will prescribe probiotics, an omega-3 fish oil, magnesium supplements. They may want to test your microbiome. They will also probably recommend essential oils such as lavender, chamomile, lemon, etc. They may also recommend meditating with them. They will likely recommend supplements if there is a hormone imbalance. Examples may be ashwagandha, progesterone, amino acids, etc. They may test for food allergies or chemical allergies, and they may recommend or use alternative treatments such as massage therapy, chiropractic medicine, acupuncture, and so forth. So, how do you combine both? Ask your PCP to run blood and saliva tests, hormone vitamin panels, and a cortisol saliva test. Depending on your results and the advice of your physicians, decide between supplements or prescribed medication or use both. For example, your thyroid may be slightly low. You may want to try alternative methods first and draw your labs again in a couple months. If your TSH comes back severely low, for your safety, you will probably need to be on prescribed medication, such as Synthroid. This does not mean you can't work with a naturopathic physician as well, though. You should ask if anyone in your family has had anxiety and what type of anxiety they have had. Consider the GeneSight psychotropic test to see what modern medicine medications may be beneficial for you. Another thing you could do is stop your caffeine intake. You can enroll in counseling to receive cognitive behavior therapy. This is a proven method to help combat anxiety and is crucial for almost every patient. Start on probiotics and healing your gut. Consider gluten-free, low-carb, and sugar-free diets to help aid with this. Begin exercising at least 3 to 4 days a week, even if it's just for 10 to 20 minutes. More than 50 studies show working out releases the proper hormones that combat anxiety. Incorporate the proper vitamins, start omega-3, use essential oils to your benefit, and the daily recommended amount of magnesium. Get the proper rest, consider mindfulness tracks, free on YouTube by the way, to help relax in bed. Be sure to stick to a routine. Try to get a massage at least once a month or at least every other month. You will realize how much stress you're holding in your body, and sometimes teaching your body how to relax can kind of create a reverse psychology on your body and your anxiety. And then see a psychiatrist if necessary for medication. So, what do we offer here at Magnolia Wellness? We believe using a modern and natural approach to anxiety is the most proactive way to combat it. We have worked hard to create a network that allows our members to use a third-party company for all their alternative and organic supplement needs. Basically, a one-stop shop. Through this, we are usually able to create a referral system in which the products can be obtained for completely free with additional funds for the member to afford testing, specialists, naturopathic approaches, procedures, and so forth. We have found using this method allows each person to obtain their optimal health without having to worry about the cost. Our savings program further includes free resources for our members, such as affordable physician recommendations, patient advocacy printouts, wellness plans, past webinars, meal plans, workout recommendations, a group to connect with other members, one-on-one support, and so much more. The third-party company that we use is a company called Young Living. And here are some of the supplements that you can purchase through this company for the same price as you would at the grocery store. If you look here, we have your omega-3 fish oil supplements. We have your essential oils right here. We have a stress away oil. We have lavender. We have peace and calming. We have trauma life. Over here, we have our probiotics, which are called Life 9. We even have a kids version of probiotics. So for those of you who have children suffering from anxiety, this is a great purchase right here. We have mineral essence, which has the magnesium in it. We have your vitamins, and we have a digest and cleansing line for that good gut health, and we have multi-greens to help support that. Furthermore, if you have any hormonal issues or perhaps other issues that you find are contributing to having anxiety, we have things such as cordyceps. If you have high cortisol, we have sleep essence, which has supplements that help support sleep, like melatonin. If you have a thyroid disorder, I strongly recommend Endoflex and Endogize. For those of you who have low progesterone, we have Progestin Plus, which has progesterone in it. White Angelica is a good one. We have diffusers if you're looking to meditate with essential oils. So we have a variety of options as a one-stop shop for all your organic and natural supplement needs. And then, as mentioned, we are usually able to create a referral system so you can get these supplements for free. And then on top of it, being a part of Young Living, you can get rewards points and get free products, and then just additional free products with your purchases each month. So how do you get started, and how do you afford your dream health plan? Well, the first thing you can do is contact one of the admins or the person who invited you with any questions you have. You can also view our file section for more information. You can then sign up for a starter kit. We have them as cheap as $45 and they go up to $160. So whatever you prefer, you can pick one of those. We host webinars every Wednesday with the exception of holidays. If you invite anyone and they sign up, we will place them automatically under you so you receive credit. It's also extremely helpful to you. It makes the process go by way faster if you invite people to our group. However, you do not have to invite anyone. We will still work hard to place others under you. It may just take a lot longer. Plus, it's really easy to invite, like I said. We do all the work, we provide all the resources. Just add them to the group and we can usually take it from there. Using this referral system, we are able to work hard towards getting your products for free. And again, as mentioned, extra funding left over to see the healthcare providers you actually want and deserve. That's a big, big, big important factor to this. You deserve to see. The most work you'll ever have to do is order the products you want to order and invite people to our webinars. You don't even have to attend them, but just invite people to them if it's someone you think may be interested in a topic that we are doing. So you are in control of your health, and despite whatever financial hardships you are facing, to be able to take control of your health the way you want to, this is a great stepping stone, is a great resource, a great outlet to get you where you want to go this upcoming year in 2019. So if you have any questions, whether it's about anxiety, our program, any recommendations we may have as far as physicians go in your area, feel free to contact us at Magnolia Wellness Network at gmail.com or contact one of the admins in the group. We have some great upcoming events listed here, and they will also be listed in our group. Other than that, that wraps up our presentation on coping with anxiety, and we really appreciate your time. And again, any questions, just feel free to ask them below or contact one of us. Thanks for watching.